Hello, my name is Peter Room, and I am part of the diagnostic team at Customed. Today I would like to inform you about the hemodynamic phenotypes that we have incorporated as one of the key innovations in Custo Diagnostic 5.9. The principle of phenotypes is nothing new. If you look at the 2023 guideline of the European Society of Hypertension, you will see that 10 phenotypes are already listed there. With the hemodynamic phenotypes, we have taken up and further developed this principle of phenotyping. The special thing about the hemodynamic phenotypes is that they simply use the data originating from a normal 24-hour blood pressure measurement as input parameters. And on the basis of this 24-hour blood pressure measurement, certain cardiovascular parameters are determined. Previously, their determination was much more complex because other methods were used. I would like you to take a brief look at these cardiovascular parameters. The first key parameter to be mentioned here is the stroke volume, which we can determine from the 24-hour blood pressure measurement. The cardiac output and the cardiac index can then be determined on the basis of the stroke volume. The next parameter we have is the pulse pressure, which we already had before as the difference between systole and diastole. In addition, there is the systemic vascular resistance, which describes the resistance in the periphery, but also the resistance in the center, which means in the aorta and the large arteries. There is the pulse wave velocity, and as the next cardiovascular parameter, the sympathetic activity index, a measure of the autonomic nervous system. We can also make a statement about the activity of the baroreceptors, namely about the baroreflex activity. And depending on how pronounced these different parameters are, 5 different phenotypes can be determined based on the expression of these parameters. The first phenotype is the cardiogenic phenotype, with the heart as a reference system, stroke volume, and cardiac index. If these values are elevated, if the heart rate is elevated, the cardiogenic phenotype is present. The second phenotype is the neurogenic phenotype, which has the balance of the autonomic nervous system and the baroreflex activity as a reference system. If the sympathetic activity index is high here, a neurogenic phenotype is present. If the volume, which means the arterial blood volume, is increased, then the volumetric phenotype is present. This is the third phenotype, which has the kidney function, and the arterial blood volume as a reference system. The fourth phenotype is the vasoconstriction phenotype, which has the small arteries and arterioles as a reference system and their ability to widen or narrow. If this is restricted and no longer optimal, the vasoconstriction phenotype is present. And the fifth and final phenotype is the stiffness phenotype, which has the aorta and the large arteries as a reference system, and which describes whether this system is still sufficiently elastic or already restricted by stiffening processes. If there is a relevant degree of restriction here, we speak of the stiffness phenotype. These are the central innovations that we have mapped here. On the one hand, the determination of these cardiovascular parameters in the hemodynamic phenotypes, and on the other hand, the formation of the hemodynamic phenotypes based on the expression of these parameters. Now, you will quite rightly ask yourself, is this even validated? And of course it is. Otherwise we wouldn't have integrated it into the software as an innovation. There are 2 key publications to be mentioned here. Firstly, the publication that deals with the validation of the method in 2021, validated and published by Alvarez Montoya and colleagues. And secondly, the publication of Aristizabal Ocampo and colleagues from 2023. in which this concept of hemodynamic phenotypes was used in a clinical study involving over 7,000 patients, who were then treated according to their hemodynamic phenotypes, and follow-up examinations were carried out to see how the blood pressure situation had changed in these patients, whether it had improved when the hemodynamic phenotypes were used as input parameters.
Blutdrucksituation bei diesen Patienten verändert hat, ob die sich verbessert hat, wenn man als Inputparameter eben die Phänotypen zugrunde legt, die hemodynamischen Phänotypen zugrunde legt.
It was shown that using this method provides a simple and efficient way of treating patients in a targeted way.
Effiziente Möglichkeit eben besteht, Patienten zielgerichtet zu behandeln.
And we have implemented this in custo diagnostic. If you have activated the hemodynamic phenotypes module in the blood pressure module, you will see a graphic presentation where we have listed the individual cardiovascular parameters according to their continuum from normal to abnormal expression, which means beyond the limit values.
Nicht mehr normaler, also über die Grenzwerte hinausgehende Ausprägung. Da wird dann eben
Here the user can see where the patient is positioned regarding a particular parameter. Furthermore, the blood pressure results, as well as the analysis of the phenotypes, are presented as text.
Analyse der Phänotypen eben statt, was auch verschriftlicht wurde.
Due to the combination of these two text elements, blood pressure results and phenotype analysis, together with the graphic presentation, you can recognize at a glance which phenotype this patient belongs to. If you know the phenotype, you also know how you can treat this patient in a targeted and efficient way, and you can quickly and easily arrive at a result that helps you and the patient. And that is what we want to achieve with Custo Diagnostic and with you. Thank you very much.